Hi, I'm Dr. Shruti. So, we are talking or discussing about dementia, which is one of the raising health problem nowadays. As the life expectancy increases, the incidence of dementia is also getting up very high. So, what is dementia? When we say it in medical terms, it is a process of cognitive impairment, that is a total mental ability of an individual with clear consciousness. So, the major areas which we've been affected by dementia are the memory, obviously, as well as spatial orientation, language, decision making, judgment, etc. So, this dementia is a long chronic process, and obviously, in the later stages, it will be affecting the day to day processes. That is, the late daily routine will be affected when the patient is going into the late stages of dementia. There are different types of dementia. One among or the most common will be Alzheimer's, which is occurs in old age. It is due to the degeneration of neurons, which happens due to the aging process, as well as due to the loss of brain volume, which happens in old age people. And the second most common will be vascular dementia, where the blood supply to the brain areas, mainly which is meant for memory, will be affected due to the decreased blood flow or the stoppage of blood flow. And there are many other types also, like unspecified dementia due to substance use and all. And when we look into the causes, as already told about the Alzheimer's and vascular, there are many other things which lead to dementia, like hypothyroidism. We have vitamin B1, vitamin B12 deficiencies, which is mostly due to the chronic alcohol use. We have substances which is causing dementia, like inhalant abuse, infections that is leading to dementia. And obviously, when a person has having a traumatic brain injuries which is causing hematoma or a space occupying lesions or mets to the brain tissues, these are the main causes of dementia. And when we come to the risk factors which is leading to dementia, we have old age, obviously, as well as we have obesity, female gender, people having old or past history of any stroke or coronary artery diseases, a known case of hyperlipidemia or diabetes mellitus, patients having an inhalant abuse in the younger stage, where we see dementia having an early age of onset, as well as there are early episodes of depression, which can also lead to an early ages of dementia. So these are the risk factors and causes of dementia. And when we come to the signs of dementia, early picking up of dementia is very difficult because the individual will themselves try to concede all the symptoms, and they try to function as much normal as before. So we will be noticing only the in the later stages, or when they have any other slight behavior problem. So the symptoms can be divided into cognitive as well as behavioral. When we come to the cognitive part, there will be a complete decline in the total mental ability of the individual. That is, their functioning will be affected. They will not be able to think or logically act according to the circumstances, and there will be confusions mainly in the evening hours. That will be worsening of symptoms during the evening or the night time. The patient will be having difficulty in way finding. That is, when that is they don't able to go to the places or come back to their home in very natural way. That is, they used to have to go to that places very often, but they will not be able to come back. They have lost the idea, or they're not able to keep up their memory. And obviously, the forgetfulness in the daily activities, like they are not able to ask or tell what happens in the recent hours, but they are able to recollect what will happen in past years. The memory will be only for the recent things, and the remote one, that is the older ones, will be very intact. So if when we ask about the memory problems to a bystander, they will tell that she remembers things that happened 10 years back. But when we ask her what did you have for the breakfast or what did you have for the yesterday's dinner, she may not be or he may not be able to recollect it. That is, the memory will be affected only for the recent events, not for the past events. And when we come to the disorientation, that is, they are not able to tell which day, which week, which month, which year, or where they belong to, which place they are staying. They are not able to tell correctly about the all these things. And their inability to understand languages, they may not be speak properly. They are not able to identify familiar faces. Inability to identify familiar objects or name objects. They have frequent falls. They have unsteadiness in walking. So these are the cognitive symptoms which we see in dementia. Then we have behavioral symptoms, which is usually presented to a psychiatrist as such. So the behavioral symptoms are mainly aggressiveness or abusive or assaultive behavior, which is very uncommon in that individual. That is, before the patient will be very calm or a composed one, but suddenly when the dementia sets into the later stages, the patient becomes aggressive for no reason or for trivial reasons. Even without any precipitation or triggering factors, they get restless, they become angry, they start to abuse in obscene words and all. And there is a personality marked personality changes will be also seen in patients, like they will be much active one, but suddenly they become emotivated, apathic, and not interested in many things. They started to have anxiety of being alone, or fear to be being alone. They have depression, which has been seen in the early stages of dementia. Like they think they are lonely, they are not able to do the things as before. They find difficulties in remembering things. They are not able to do, even they are not able to dress properly, eat properly, or have sleep disturbances. That is, they have either delay in onset of sleep, or they are not able to get a continuous sleep. They will be mostly awake throughout the night, and they have some sleep in the daytime. And this problem is becoming worse when they started to also disturb the other people in the family when they are not getting the sleep. And to the highest side, we will be able to have this psychotic symptoms in dementia patients, like visual hallucinations is very common in dementia patients. They will able to see images or person standing or sitting near to them. They are able to hear the voices. They become paranoid. They started to have suspiciousness about the family members, that they are trying to hurt or harm them, or they are talking bad about them. Some referential as well as persecutory delusions are also being very common in dementia patients. They started to have disinhibited behavior. They started to urinate in public places without any shame. All this disinhibited behavior comes when the frontal lobe of affected in the dementia. So these are the behavioral symptoms which are seen in dementia, and a person can present either with cognitive or with behavioral symptoms, or with a combination of all these things. And obviously, when it comes to the management part, the drugs have actually a limited uh, role in the cognitive functioning of a patient, because it's already been degenerated neurons, and the only thing that drugs can do is they can slow down the process of degeneration, as well as they have can give some cognitive enhancers, which will be needed for a long course. And when we come to the behavioral part, the medications will be of much help. That is, when we have depression or anxiety, we can give antidepressants like SSRIs, or we can give anti-anxiety medications. Obviously, antipsychotics will be needed for the person who is having psychotic symptoms, and these behavioral symptoms is well responding to the medications when compared to the cognitive symptoms. So the main tips for the caregivers are that taking care of a dementia patient is very actually a lot being burdening. It is demanding as well as tiring. So being patient and calm to the patient suffering from dementia is very important, because when we being panic or being arrogant to the patients, the dementiating individual will be becoming having more behavioral problems. So first we will have a routine plan for the old age person, like time set for their sleep, eating meals, as well as for physical activities or having any pleasurable activities. We will set a schedule for the individual to be done in 24 hours. And then we'll be have to reduce the confusions at night. We can make them to have the sleep in a dim light. We can make them to lie in a bed which is very near to the bathroom, so that at the night time we can reduce the rate of falls or the unwanted confusion in the spatial orientation and all. Obviously, the medications is of a great part, because adherence to medications will be helping you reducing all the behavioral symptoms. And it is the bystanders can also take into account that they can get a help from others, because as single-handed will increase the burnout, and obviously that will affect the prognosis of the individual also. For depressive symptoms and all, they can be engaged into any pleasurable activities like gardening or reading books which they were interested in before, and they can be also taken out to a family hangout, or involve in their family conversation, so that they are not feeling alone, and keep them more active in the daytime, so that their sleep pattern will be much more and sleep hygiene will be much more helpful to get sleep. So these are all the tips for the bystanders, and they can get or they can pick up the dementia as early as possible. Then it is well and good, because as early as we start on the treatment, there will be much prognostic benefits on the patient also, rather than getting into the later stages and being helpless on it. So these are the few ideas about the early signs, as well as tips or management for the bystanders in patients who are suffering from dementia. So thank you, one and all.